Okay, Bismillahirrahmanirrahim. This is our part 4 of the upper limb. During dissection of first aid MBBS, a student observed a nerve passing from the forearm into the wrist, which muscle can serve as a reliable landmark to identify this nerve. The nerve is the median nerve. How the nerve in this question is the median nerve, which passes from the anterior compartment of the forearm into the wrist. At the wrist, the palmaris longus tendon lies directly superficial to the median nerve, and it is an excellent landmark. The tendon of the flexor carpi radialis lies lateral to it, while the flexor carpi ulnaris lies on the medial side with the ulnar side. Not everyone has a palmaris longus. It can be absent in some individuals, but when present, it is the most reliable guide to the median nerve in this region. So the answer in this region is palmaris longus, that is D. ठीक है. Now come to the question number 32. After a difficult forceps delivery, a baby girl was not noted to have her left forearm pronated with the elbow extended, and a few weeks later, which the muscle is most likely to get paralyzed. A difficult forceps delivery can stretch or injure the upper trunk of the cervical CA plexus, that is C5, C6, that is known as Erb's palsy. The bicep brachii is the main muscle for the forearm supination and a strong elbow flexor. When it is paralyzed, the forearm remains pronated because pronators can act unopposed. The elbow stays are extended because triceps act unopposed. This produces the classic waiter stiff position: arm adducted, medially rotated, elbow extended, forearm. Therefore, the loss of the bicep brachii function explains the baby procedure. Question number 33. A man suffered a deep stab wound on the medial side of the cubicle to fossa, which structure is most likely to get damaged. Now see the explanation. The cubital fossa contains the most important structures lateral to medial, that is TEN for learning, tendon, artery and vein. Tendon is bicep brachii tendon, then brachial artery and then median nerve. Since this injury is on the medial side, so the median nerve is going to get damaged. Damage to the median nerve would cause loss of the forearm pronation, wrist relaxation, weak wrist flexion, loss of the thenar muscle function, ape hand deformity, which is also known as. Therefore, the median nerve is the correct answer, or which is it has been damaged in this scenario. Question number 34. A 15-year-old fell on a nail that pierced his hand between the two heads of the first dorsal interosseous muscle, which artery is likely injured at this stage. Now see the explanation. The radial artery passes between the two heads of the first dorsal interosseous muscle at the base of the first metacarpal near the thumb. After passing through this space, it contributes to the deep palmar arch. Other options. Anterior interosseous artery runs along forearm, not at this side. First palmar metacarpal artery, branch of the deep palmar branch, small vessel. Princeps pollicis artery, branch of the radial artery to the thumb, more distal. Therefore, the artery most likely lacerated in this case is the radial artery. Question number 35. A 12-year-old boy with fracture of medial epicondyle, unable to flex and adduct wrist muscle affected, flexor carpi ulnaris. Ulnar muscle is damaged. So, the explanation is medial epicondyle commonly injured the ulnar nerve, which supplies the flexor carpi ulnaris and the medial ulnar half of the flexor digitorum profundus. The extensors are radial, flexor carpi radialis, and flexor digitorum superficialis are the median. Question number 36. While dissecting the anterior forearm from the medial side to find the median nerve, which muscle must be cut off? Flexor carpi ulnaris, flexor digitorum superficialis, flexor pollicis longus, pronator quadratus and pronator teres. In the forearm, the median nerve lies deep to the flexor digitorum superficialis, running between the flexor digitorum superficialis and flexor digitorum profundus. Although flexor carpi ulnaris is the most superficial muscle, it overlies the ulnar nerve. Cutting flexor digitorum superficialis opposes the median nerve beneath it. Question number 37. A 3-year-old develops acute elbow pain being yanked by a pronated forearm. Which ligament is involved? Annular ligament is involved. Classic pulled elbow subluxation of the radial head when the radial head slips out from the annular ligament after the traction of the pronated forearm. Question number 38 is: an athlete fractured the clavicle at the junction of the middle and lateral third. Which ligaments are most likely to get torn? That are the coracoclavicular ligaments stabilizing the lateral A clavicle consists of two parts, that is conoid and trapezoid part. So that is the answer. Now question number 39. For routine blood sampling in the lab, which vein is typically easier to access? Basalic, brachial, cephalic, median cubital vein, median vein of the forearm, median cubital vein. Why? Because it is superficial, relatively fixed होती है, forms a large consistent channel in the cubital fossa, making it a standard vein for the venipuncture. ठीक है? In the viva, it can also be asked. Question number 40 is 59-year-old woman presents with a fracture of the neck of the humerus and absent pulses in the upper limb after trauma. Which artery is most likely to get damaged? That is, the axillary artery lies close to the surgical neck of the humerus. Fracture at the site can lacerate the axillary artery, loss of the distal pulses. That is, the answer is axillary. Okay, question number 41 is a 20-year-old boxer suffers an oblique fracture at the surgical neck of the humerus. Which muscle is most likely to get damaged? Deltoid muscle. The axillary nerve supplies with the runs with the posterior circumflex artery around the surgical neck. It innervates the deltoid. Fracture here damages the nerve and weakens the arm abduction. Question number 42. A 20-year-old athlete sustains a fall and develops a lesion of the lateral brachial plexus, weakness of which muscle would most be expected? Pectoralis major. Why? Because the lateral cord gives the lateral pectoral nerve which supplies the clavicular head of the pectoralis major muscle. That's how we identify the answer. During dissection of the wrist, the ulnar nerve is seen passing through a depression between the carpal bones, which ligament converts this depression into a tunnel, Guyon's canal. The reasoning is pisiform ligament. It stretches from the pisiform to the hook of the hamate, converting the groove into the Guyon's canal. Transmits the ulnar nerve. Question number 44. 44. An 18-year-old woman has a crushing hand injury. On examination, she shows weak flexion at the metacarpophalangeal joint and inability to adduct her fingers. Which muscle is most likely to get affected? Palmar introitiae, metacarpophalangeal joint flexion, lumbricals plus introitiae, finger adduction. Palmar introitiae, that is pad palmar adduct करवाएगा. ठीक है. Thus involvement of palmar introitiae explains both findings. Question number 25. A 29-year-old pregnant woman complains of pain and tingling in the lateral third 3.5 finger worsen at night and interfering with the hand function. Which nerve is most likely to get damaged? Median nerve. Because this is a carpal tunnel syndrome. Paresthesia in the lateral third three finger, which we have already discussed. Question number 46. A 24-year-old man using crutches for 6 months developed numbness over the lateral arm behind the lateral insertion. Which nerve is most likely to get involved? This is a branch of the axillary nerve, that lower lateral cutaneous nerve. Chronic crutch pressure can injure it. Sensory loss over the skin below the deltoid regimental badge area. That's it.